Hello everybody, recording live from somewhere. This is Zach Couples with episode number 65 of the Movement Debrief. And tonight, folks, we're gonna have one that is dope as all hell. We're gonna talk about cervical retraction. Is that useful? Short answer, no. We're gonna talk about a neutral spine. Is there such a thing? Should you coach that? What are you going to do about it? That's what's also on docket. And last but not least, we're going to talk about lateralization. What does that mean even? How does that impact our movement capabilities? Yes, folks, those are the questions tonight. And they are asked from the people, answered for the people, by this people, fam recognized fam. Before I dive in, actually major housekeeping, because guess what, folks? If you feel as though you've been struggling a little bit getting your movement capabilities of your people to the next level, or maybe you're working with someone in pain and maybe they hurt a lot of areas and you don't know where to start, you would just love to streamline the home exercise program, give them one thing to address multiple areas, where would you go for that? I'm glad you asked, because I have the answer, and it's called 2 words. Human matrix. And yes, it is coming your way multiple places this weekend, folks. If you are near Kansas City, Missouri, yes, October 27th, 28th, I will be there. It's going to be off the heezy. It's going to be a nice, good group of people. Kyle Dobbs is going to be there, for crying out loud. Why aren't you there? He's cool. Lucy Hendricks, the holistic fitness connector herself, will also be there. You don't want to miss it. But if you have to, I get it. Come see me in November 10th and 11th in Portland, Oregon for round 2. If you can't attend that, come on, maybe attend all of these. Go to Charleston, South Carolina. That's going to be December 8th and 9th. And then I have one in New Jersey, in New Providence, New Jersey to be exact, next year, February 2nd and 3rd. Or how about this, folks? Perhaps you're in the land of China. I'm working on a little bit of going back there again. Yes, Big Z is going back to China. Big Z in Little China, not to be confused with Big Trouble in Little China. We're going to be there in January. That's going to be a whole lot of fun. I'm excited to talk to those people, wonderful people in China. That would be the human matrix side of things. But maybe you can only stand listening to me for about half of a 2-day. And maybe, you like Pat Davidson and you like Seth Oberst, and you want to work with people along the entire continuum, from the lowest level of stress, pain, and rehab to the highest level of training, because they fill in my gaps, I fill in their gaps. We got the revolution. Anti-Fragility is the name. In Boston, Massachusetts will be the game. That's going to be February 9th and 10th. I hope to see you there. Without further ado, let's debrief, shall we? The first question comes from Lucy, the holistic fitness connector herself. Lucy asks, Big Z dollar signs, what's good with you, fam? What is your opinion on neck and head retraction exercises to fix forward head posture? I notice you tend to put a pillow behind the head. What's your approach to affecting neck posture? Fam recognized fam, Lucy. Lucy, that's an unbelievable question. I'm glad you asked it. First off, what is cervical retraction? Well, let's step back. What's forward head posture? That. Basically, the cervical spine flexes forward, you get OA extension, and some people will utilize cervical retraction to correct that. And so that would be pushing the chin back into the spine. So you're forward, push yourself back. Very prevalent treatment in McKenzie, among other things. And the question would be, does this fix forward head posture? I would have to give a resounding no. I would also have to say that I don't really recommend this treatment style for a few reasons. We see people assume specific postures, but rarely do we ask why. Sure, maybe it's the computer and all that, but not everyone who goes on a computer all day or a day is in this forward head position. In fact, a lot of the people who I've worked with now, or in the past, actually do this thing where they sit super perched on the edge of the chair, and then they have this nice arch in their back, and they're pushing their head back into this retraction position. So I don't think we can always blame the computers. Now, no, I think there's a different reason why. I think the reason likely has to do with how that individual can best manage airflow. One, do I get an adequate need for airflow? And two, can I utilize my body in such a manner that I can generate effective pressure to manage the internal and external stressors in my environment? A forward head posture is one potential strategy that someone could use. A military posture, where they are retracted back to begin with, could be another strategy that someone uses. Can be used for a lot of different things. One of these strategies closes the airway more. One of them opens the airway more. Can you guess? I'll give you 2 seconds. 1,000, 2,000. What happens is this. When I go into a forward head position, the airway actually opens and becomes longer front to back. This is why when you're giving someone CPR, you tilt the head back. It opens the airway because I'm getting OA extension. The mandible also retrudes, and the jaw usually drops down because that is more of a mouth breathing position. Think about this. I have a huge oral airway now. I'm going to open my mouth to uptake as much air as possible. This is a common strategy for people to utilize if maybe there is some issue with the nasal airway. For example, maybe you have a deviated septum, maybe you have allergies, and you want to utilize an effective mouth breathing strategy. Well, guess what? That would be a way to do it. The problem with that, potentially, is the retrude, depending on the extent of the mandibular retrusion, that could potentially block the airway to an extent that might be considered maladaptive or threatening to that individual. So what some people could do is, as a means of correcting that, is shove the head back so the mandible comes a bit more forward. But the problem is when you retract the neck and the head, you constrict the airway. So it gets smaller, even though you might have a little bit more space in the airway from a mandibular standpoint. So if you are coaching your people, hey, you go forward head, I'm going to push you back. Well, guess what? If that's not an effective breathing strategy for them to manage their internal and external stressors, they're not going to do it no matter how much you try. You have to fix the breathing. Moreover, you're probably suffocating your peeps for a little bit. That ain't cool. Why are you doing that? Just kidding. I've done it before too. So I don't utilize that as a thing to fix forward head posture. The fix comes from the respiratory system. I also wouldn't utilize something such as a chin tuck, which you would think if I have OA extension, maybe a chin tuck would help me out with that. Not necessarily, because a chin tuck may fix OA position, but you also may have to consider doing some things with hyoid musculature or with things down low to normalize the lordotic curve, because that's one problem that people have is I get this forward flex position and then I have a potential for maybe losing lordosis or even going hyperlordotic in some cases, depending on the extent. So what you want to do is, for that type of person, if you have a forward head position, make sure you are addressing the rib cage. If I have an increase in thoracic kyphosis and maybe I can't get the pump handle up to get going the way I want it to, which if you want to learn more about that, there's a debrief for it. I'll link it in the show notes, which will be available tomorrow on zachcouples.com. Pump handle. But you want to get this opened up, and maybe that takes care of everything. Maybe the problem isn't the head position, but it's the fact that they can't get air down here, and if you push that up, get them a little bit better airflow, maybe that takes care of the forward head posture because you have given that person another breathing option available to their disposal. That would be where I would go first. Once you've done that, then maybe a mild chin tuck is okay, but not for the reasons you think. It's not to kick in the deep neck flexors. We often forget about the muscles that attach to the hyoid, which are more superficial to the deep neck flexors. When the head goes forward, like so, the mandible actually, or not the mandible, the hyoid actually depresses. So you get an eccentric orientation of your suprahyoid musculature. We kind of want that flip-flopped. That's where getting someone more upright by maybe moving air into the chest can be effective, and then a mild chin tuck with maybe a little bit of mandibular protrusion can actually alter that relationship of the suprahyoid musculature. That would be what I would go with. Now, Lucy also mentioned something about using a pillow behind the head. I generally do that when I have someone who has a military posture. Because if they're here, well, they have a reduction of the cervical curvature, they have OA flexion. Sometimes I'll put a pillow or two or three to get them out of that position, to allow for some OA extension to open up the airway and maybe restore lordosis to a degree. That's when I would use the pillow. A lot of times you'll get these people where maybe they're narrow infrasternal angle, narrow infrapubic angle, but somehow they've compensated and done the military position, which would elevate the hyoid. No bueno if we are talking about airflow there, folks. But for those people, a lot of times if you put pillows underneath their head and get a little OA extension, especially if they get neck tension with reaching, that oftentimes takes it away. Because I think the reason why they get neck tension is because everything is clamped down so much in the cervical spine, you try to reach forward, the muscles that attach between the cervical, or the head and the neck and the scapula are so concentrically active that they just don't get that chance to chill. Whereas if you fix the head position, a lot of times that takes care of things. Also, fixing the head position in the way that I described will interrupt the relationship between rectus abdominis and the hyoid muscles. They're really the same muscles, but they're just separated by a bone. At least some of them, the ones that are more superior, inferior in their orientation. And a lot of times if, let's say I'm this, and I have suprahyoid muscles which are concentrically active and maybe infrahyoid which are eccentrically active, well, if I go through an exhale, because there's more space to go downward this way, rectus abdominis can actually get a little bit better mechanical advantage. However, if I orient the head so that relationship with the hyoid muscles is flip-flopped, and my infrahyoid muscles, because the hyoid drops down, are a bit more concentrically active, which would elevate the sternum to a degree, then the rectus can't get the leverage that would potentially drop the sternum in an exhale position. So you use the neck to get the rectus to chill out. If you want to learn more about chilling out rectus, you might want to tune into last week's debrief. I'll link that in the show notes as well, why not? But that's really my strategy for fixing head position from a movement context. So to summarize that before I dive into this next little bit, big things. This forward head posture or military posture are not just assumed because. There's probably a good reason for that, and it likely helps with managing forces and also with airflow. You don't simply push the head back or do a hard chin tuck. You have to consider hyoid position. For the forward head, the hyoid is dropped. You have to elevate it. Sometimes that's simply just getting more air into the front of the chest and doing a slight chin nod, not a full-blown chin tuck. Maybe even mandibular protrusion to get some concentric activity of the suprahyoid muscles. For someone who's more military posture, I'm cool shoving the head forward and getting a little bit of OA extension because it flip-flops the relationship of the hyoid muscles. The infrahyoid musculature becomes more concentrically active when it is typically in an eccentrically oriented state. Now that's the movement standpoint. There are obviously also, well, maybe it's not obvious, but there are other potential airway limitations that you may consider that are outside of most people's scopes. Maybe the reason why someone has a forward head, like I had mentioned before, is because they have a deviated septum and there's a structural deformity. Maybe they have a mid-face deficiency, which is closing the airway, and that would be where the maxilla, or this bone, Jesus, can't think. You have the orbit here, and you have the maxilla, and basically the lower portion of the face pushed back in relation to that, when it really should be forward. That can also have an impact on the airway, and maybe that requires some type of dental intervention. Or maybe you have a tongue tie, and that could potentially impact airway because you might have an inability to keep your tongue on the roof of your mouth, so a more efficient breathing strategy because you can't pressurize the palate effectively, and maybe that impacts nasal airway, is to go with a forward head and open mouth. Those could be other things you may potentially consider in regards to addressing airway and maybe why this person is assuming the postures that we're talking about. But I would only do that if and only if I have addressed the movement components first, because those could be costly endeavors. And I haven't read much into the research to say whether these things work or not for what we're trying to achieve. But I'm just thinking through this from where on the airway could I have a rate limiting step. And those are three common areas that could potentially impact someone's breathing and subsequent default posturing. Lucy, that is a stellar question. Rock on, girl. The next question comes from Tobias. We had a lot of good questions. Hang on, someone's asking something. Kyle, would a prominent Adam's apple be an indication of anything? Not necessarily. And I probably should have stated this, but you can check to see if you have an elevated hyoid. Here's how. One way. If you go into cervical extension with your teeth closed and you open your mouth and your head goes way further back, you probably got an elevated hyoid. Another test that I utilize would be maximally flexing the head and then rotating side to side. If you have greater than 60 degrees of cervical rotation, probably got an elevated hyoid. The reason for the latter would be because that person is in OA flexion. You get lengthening of the alar ligaments among some of the other muscles or tissues that would potentially check rotation, so you get a lot of mobility in that regard. Those would be two ways that I would confirm someone has an elevated hyoid. Sometimes too, although I don't find it as reliable, but it kind of makes sense to me if the spine is flat. Doing chin to chest as well, if that's also limited along with the other three, good chance you probably got an elevated hyoid. So that would be what I would utilize as opposed to static posturing, Kyle. So great question, great question. The next humdinger of a question comes from Tobias. Tobias asks, I'm a fledgling physiotherapist from Denmark who's begun to delve into the research on low back pain. The more I read, the less convinced I get that maintaining a neutral spine during heavy lifting is of any importance with regards to avoiding pain and or injury. To me, it's beginning to look more and more like the old, don't let your knees pass on your toes when you squat dog. Facts. However, you often have quite a unique perspective on many things. Thanks. So I was wondering if you have an opinion on this matter. I'll happily detail my thoughts for you if you wish, although that's going to be a wall of text. This is a really freaking good question. Oh, you bet, Kyle. And I'm about to maybe kill a sacred cow. So I think what most people would classify as neutral spine is underload. Does the spine look like it has an appropriate amount of whatever we've conceived as a lordosis or a lordotic curve, maybe kyphosis, or in some cases, if I'm doing maybe a heavy deadlift, is the spine look relatively straight? My problem with this is we can't really tell what's going on with the spine under load, or really in general, because we can't see the specific segments. And I'm not just making this up. That neutral spine is kind of bullshit. But let me go to the research for this. Here's a study by McKean et al., the lumbar and sacrum movement pattern during the back squat exercise. And I will link this to the show notes for y'all to read. But interesting tidbit. So if we want to have a nice little arch when we're doing a squat or something like that, guess what? The lumbar spine, according to this study, became kyphotic as soon as load was placed on the shoulders. And any teaching cues to maintain a curved lumbar spine when squatting must be questioned. So if we're saying that we're trying to maintain a neutral spine under load, and as soon as you put load on someone's back, instead of the lumbar curve being lordotic, it becomes kyphotic, what are you doing? There is no such thing as neutral spine. It's a myth. Because the spine is going to move, morph, and adapt based on the demands placed into it, and based on the constraints of the environment that is put in. So in a back squat, we certainly aren't maintaining a neutral spine, which would be somewhere in the middle of extreme flexion and extension. We're going right into kyphosis. So I don't really think about neutral spine anymore. I don't think about cueing a neutral spine. I've gone away, and I used to do it. I've gone away from doing the dowel rod, maintaining 3 points of contact, all of those things. What I think we have to focus on instead is, are we making sure that whatever task we're having an individual perform looks pretty? Does it match what we deem as standards for that given movement? Neutral spine is oftentimes considered a standard when we're talking about loaded-based movements. But as we can see based on this study, that might be called into question because we can never really see what the spine's doing. We can't see if that person is hinging at one segment, or if this segment is flexed and this one is extended, and though the curve still looks the same. What we can focus on, however, though, is does the loaded movement look pretty and is it efficient? When we're talking about something like a back squat or a deadlift or even an Olympic lift, the way you can tell that is not by looking at the person, but looking at the bar path. Is the bar path pretty much a straight up and down line? And this is not true just of barbell activities, but also kettlebell, any activity. Am I moving the weight in the most efficient manner possible, which is a straight line? In the case of a back squat or a deadlift or any squatting variation, that straight bar path should occur over the midfoot. Or, if you don't know what that is, which hopefully you do, get your shoe, find your shoelaces. If you can keep the bar, if this is the bar, this pen, up and down over the shoelaces, you're going to be efficient AF, if you know what I'm sizzling. That's the key. If you can coach your people to maintain that, you don't even have to worry about spine position, because a lot of times, if someone is utilizing maladaptive spinal orientation, they're probably not going to be able to maintain that efficient bar path. You get a fan who maybe tries to keep vertical shins while they're doing squatting, the bar tips forward as a means to do that. You get someone who arches too hard in the bottom of the deadlift, the bar is going to swing forward and up before going straight up. That's where you go to coaching these things to make them look pretty. Make sure you keep the bar path in a straight line. You do that, you ought to be in business. So to summarize your question, Tobias, I think neutral spine is a myth. I think that it's something we cannot measure because we can't see what the spine is doing under any circumstances. The best we can do is make sure we are coaching movements to the standard that we have agreed upon, i.e. it looks pretty. For loaded activities, which is where we consider neutral spine more often than not, that's making an efficient bar path straight up and down. Over the midfoot, if I'm doing a loaded activity, or if it's a bench, it could be from the sternum. We just want to make sure these things are in efficient lines. The shortest distance between 2 points is a straight line. You want to apply that same principle to your bar path. Tobias, unbelievable question. Much love. Maybe we get together in Denmark sometime if you know what I'm sizzling. The last question comes from Alex. Alex asks, You mentioned a few shows back about the existence of left lateralized people. And fun fact, I'm one of them. Can you talk about how you identify, assess, and treat them compared to a right lateralized person? Is a pathological driver or pattern of injury normally present, or have you found them to exist with neither? Really good question, Alex, and I think that if I did say this, I don't remember what I say a lot of times. I'm kind of like, this would be super for the hip hop nerds, but I'm kind of like an ad lib in the sense that once I drop a beat, so to speak, I don't listen to it again. But when we're talking about lateralization, we're talking about a particular movement strategy that an individual may utilize to deal with the internal and external environment. I don't remember saying left lateralized off the top of my head, because really most people right lateralize. But what I may have said is the reasons why people right lateralize are probably a bit different than what's conventionally taught by some people. Who's asking me something? Dope reference. Oh, thank you, Jordan. All right. So the reason with this lateralization, we have to ask ourselves, why do most people actually right lateralize? And the reason is likely, if you talk to my boy Daddy-O Pops, Bill Hartman, which I'll link the shit out of him in the show notes. But most of our internal organs have somewhat of a leftward shift based on their attachment points, based on the right-hand rule of physics. I'll link that if y'all don't know what that is. Among other things. The guts in particular have a 270-degree spin clockwise. There's more space here for them to spin and move. So we have our internal anatomy actually pulling us to the left. It's not necessarily a left lateralization, but that's just where the forces are going. And it's not just here, but it's most of the internal organs. And as a means to counteract that, well, fun factoid, that's potentially why a lot of us, or most running tracks are counterclockwise, and most other things are counterclockwise, is because it's easier based on how we manage our internal and external stressors in the environment. But as a means to prevent us from falling over from that force within us, yes, we have force within us, the force is with you, strong with you maybe, we will lateralize or utilize things to the right-hand side to prevent that from happening. This is not just demonstrated in our internal anatomy in terms of our organs, but from a brain standpoint. Motor planning occurs on the left hemisphere, which is much stronger on the right-hand side. And this is true regardless of if you are right or left-handed. They did a study, I have to find it, but I will, left-handed study, where they took lefties and they had them move objects in a various manner and show with both hands and show which was more comfortable. All the lefties consistently voted right. So we do have a rightward preference, regardless of hand dominance. As a lefty, I can attest to that. And the reason why that probably is to allow us to better adapt to some of these forces that we have to cope with. That's more so what I'm talking about. If you see someone who may be left lateralized or is left-handed, maybe they did not do a good enough job counteracting that stressor, or maybe that is some type of compensatory strategy that that individual has adapted, and actually, according to the research, it's more of a behavioral preference as opposed to something anatomically based. I'll also link that one, lefty research. But maybe that person has somehow, despite the body's best efforts to throw them left, went with it as a coping strategy. Is it pathological? Are these people more likely to be injured? I don't know. It's something that I haven't looked at necessarily in depth, although maybe I should. But what would I do with them? Does it matter, if someone is right-handed, left-handed, if they have a right lateralization, or maybe they don't lateralize right to the well, and they're falling over because they can't manage their bodies? I really would treat all of these people the same. It would be based off of my objective testing. Do they have access to all of their movement options available? So they have multiple strategies to cope with the internal and external environment. Do they have conditioning levels that are conducive to coping with these stressors? Are they moving efficiently in a manner that helps them meet their goals? These would be the questions that I would ask with these people, Alex. That's what I would say is probably the most important thing, because we're not going to change internal anatomy. We're not going to change the locations of where certain things happen in the brain, but what we can change is how, given those constraints, we operate within them. We can be more efficient with movement, we can have greater options available, we can have an increase in movement variability, and all of these things can be beneficial. That's really what I'm thinking we have to emphasize with lateralization, and that's kind of what I mean by lateralization. So to summarize your question, Alex, most people are right lateralized because of our internal anatomy. The one case where that wouldn't be would be cytosine versus totalis, where the organs are flip-flopped. And we use that as a means to deal with the internal and external stressors that are pushing us to the left, i.e. the internal organs and the way they move within us. There are compensatory strategies that adapt in the brain to promote this. There are some people who can utilize their left hand a bit more effectively, and that may be a compensatory strategy on top of the lateralization, and that could potentially have some implications as a means to potentially what movement limitations they have, among other things, or how well they adapt to the stressors within their body. But this is more of a behavioral preference, not necessarily something of anatomical importance. The key with any of these people is to treat what you see. Trust your objective testing, restore your movement options, build conditioning up to the highest level possible, and take care of all the other things necessary to allow people to meet their health and performance goals. Alex, great question, and I think that's a good stopping point for us tonight. I want to thank you guys so much for tuning in. If you want to learn more, besides this debrief, there's a few places you can find me. First, you can find me on ZachCouples.com. While you're there, you might want to subscribe to my newsletter, because here's what you'll get. Yes, stay tuned. You're going to get 4.5 hours of me talking. 3 of those hours are regarding breathing and some of the stuff that I mentioned in this debrief and prior debriefs. An hour and a half is going to be on pain. Yes, pain. Definitely want to do that. You'll also get a free acute chronic workload calculator, which can help you with managing workload so you lessen the likelihood of you sustaining injuries that are load-based. You're also going to get weekend goodies from me every Friday, which is where I scour the internet, finding the sexiest of things to check out. And you go ahead and read them and enjoy that on your weekend. And of course, when I start releasing products, which might be happening next year, stay tuned. You guys will be the first to get discounts because you are the fam. And fam recognizes fam. You better recognize. So definitely sign up for my newsletter. Maybe you want to work with me because I can help you 3 ways. If you are toyed and not maybe moving as well as you'd like to, maybe you got some aches, pains, boo-boos, and you'd like some advices from me, or maybe, well, I don't know, you've tried your cervical retraction BS and your neck still feels wonky. I can be your guy. We can go through movement consultation where I utilize testing to see what moves you can and cannot do. We restore all of your movement options available, and my hope is that that evens out the workload distribution throughout your body, and that may help you with whatever limitations you may have. That would be a movement consultation. Or maybe, just maybe, you want to learn how to maybe apply some of the interventions I talked about with cervical retraction. Oh, I don't want to use that, but that's what I use. What should I use instead, Zach? I'm not sure what to do with my clients. Stop. I can help you. We will problem solve through how to practically apply a lot of the things that we talked about today, as well as other debriefs and other content via my mentorship program. I will help you solve some of the problems you have, give you someone to bounce ideas off of, ask you thought-provoking questions so you can find the best solution for your people and your goals. Definitely sign up for the mentorship program. And of course, maybe you just want straight gains, or you're post-rehab and you want to work on being able to load to the next level. But you're scared because Joe Blow told you you need to keep a neutral spine, and now I just blew your mind because I told you don't exist. Well, I can help you. Because guess what we can do? I can write you a program month to month. I'll perform a movement consultation on you where I do some of the testing I talked about before, and we will tailor this program specifically to your needs. That will help you reach your goals in the most efficient manner possible. Definitely sign up for me for online training. Once you've scoured ZachCouples.com, you may want to check me out on iTunes and Stitcher. Search the Zach Couples Show, because guess what, folks? There's 64 other debriefs. Now, granted, I got like a nice little beard ball head thing going, but maybe you don't want to look at me forever. Maybe you want to take me on a long car ride, or maybe you want to take me on a short car ride. Well, if you can sign up for me on iTunes or Stitcher, and please leave a review, I can be there with you on the ride. Definitely sign up to those two areas. If you want to do the whole social media thing with me, and I encourage you to do so, you can find me on Facebook. That's /ZCouples. My Twitter handle is @ZCouples. I'm on that Instagram, baby. Zach, Z-A-C, Couples, C-U-P-P-L-E-S, and I'm on YouTube. Just search Zach Couples. You're going to get a bazillion exercise variations available to you on that. Please share it with your patients, share it with your family, share it with your friends, share it with whoever. I don't care. We need the fam to grow. I want to thank you guys so much for tuning in. I want you to keep it real, but not to the extent when things go wrong. Stay hungry, stay learning, stay moving, and I'll see you next time. Deuces.